Welcome to the 5th episode of Kris Vanhaecht on Quality, where we delve into person-centered care, today with a specific focus on the patient and their kin. For those of you joining us for the first time, I'm Kris, a full professor in quality management in Leuven. I've truly appreciated the positive feedback, and thanks to Christina, these podcasts will now also be used in courses on quality in Canada. Thank you all for your kind words, and kindness is what we will discuss in this episode. It was not easy to make choices here. Lots of content and evidence available on person-centered care. Now, today we'll unpack what it really means to embrace person-centered care from the perspective of patients and their families. As Don Berwick, the former CEO of the IHI and former advisor to the great Barack Obama, once insightfully said, well, patient-centered care is not the route to the point. It is the point, period. Let me take a moment to introduce someone whose work helped me to understand what person-centered care is about. Eva Marie Castro. Eva, a former PhD student of mine and who became a dear colleague, is now a quality manager at a community hospital in Flanders. Though she has moved into a more operational role, we still collaborate closely, particularly on challenges surrounding person-centered care. Eva published an interesting concept paper, which I had the privilege of supervising during her PhD. It is a valuable resource with over 1,000 citations. It deals with 3 interconnected pillars of patient-centered care concepts: empowerment, participation, and focusing on patient-centeredness, or better yet, person-centeredness. What makes her work remarkable is how she distinguishes these ideas, which are often confused in both academic literature and practical applications. We may ask the question, why is this distinction so important? Because it fundamentally determines how care is provided and experienced. Empowering patients means, for example, giving people the knowledge and ability to make their own decisions about their health and the aspects they consider important. It is both a process of encouraging autonomy and a practice of supporting informed choices. However, this can only be done effectively through a robust dialogue between patients and healthcare providers, a theme that repeatedly emerged in the study. Without open, respectful communication, empowerment threatens to become a hollow phrase instead of a driving force behind better health outcomes. Okay, now over to participation. Participation shifts the focus to collaboration. Patients are not just recipients of care, but can be active partners in shaping their diagnostics and treatment plan. This collaboration ensures that we can truly put patients first. And then there is the focus on the person, which functions as an overarching philosophy and means that the person with their specific background, goals, values, and standards, not just the disease, is central to everything we do. So, these 3 pillars, empowerment, participation, and putting the person at the center, although different, are inextricably linked. Dialogue is the thread that weaves them together. It is through meaningful conversations based on mutual respect and understanding, that we can promote true empowerment, participation, and patient-centered approaches. Or since 2018, we call patient-centered, now nearly always person-centered, in search of the person, the whole human being, the human behind the patient. Eva's work reminds us that the words we use to describe care are more than academic constructs. They are tools that shape practice. And as we have seen time and again, communication is at the heart of quality. Without communication, even the most advanced treatments and protocols are lost. When we reflect on the legacy of this research, it is clear that Eva's contributions illuminate a path forward. They force us to pause and evaluate how we, as caregivers or researchers, interpret and apply these ideas in our daily work. The commitment to promote empowerment, participation, and a focus on the individual is not only a professional obligation, but also a moral one. By respecting these principles, we affirm the humanity of healthcare itself. Let us go back to some foundations. So, when we talk about person-centered care, what we're really addressing is a foundation built on dignity and respect. It may sound simple, yet as studies continually show, this dimension remains pivotal. In the ongoing work of the FLACM Consortium, the Flanders Quality Model Consortium, data from patients and their kin ranked dignity and respect as the top factor correlating with overall quality of care. And this research results are still awaiting publication. This finding was profound, underscoring that no matter how advanced or innovative our systems become, the human experience of care remains anchored in being treated with respect. I hope the paper, in collaboration with 25 leading Flemish hospitals and under the lead of two great postdoc researchers, Shainaz and Deborah, that this paper will be published soon so we can share the detailed results with all of you. Consider for a moment the powerful implications of dignity and respect as a dimension of multidimensional quality. So this means, by prioritizing dignity and respect, organizations not only improve their quality metrics, but also foster an environment where trust can thrive. Trust isn't just a feeling, it's an outcome of consistent, respectful interactions, as we explored through the House of Trust model in an earlier podcast that is still available at Spotify or via my own website. The front office, where care is experienced, and the back office, where systems are designed, must operate in harmony to uphold these values. Without this coherence, person-centered care risks being relegated to a superficial ideal rather than becoming the everyday standard of practice. Interestingly, the connection between person-centered care and safety is drawing renewed attention. For example, the National Health Service in the UK has introduced an initiative called Martha's Rule, a response to tragic cases that highlighted gaps in safety and communication. Martha's Rule allows patients and families to advocate for urgent reviews when they feel that concerns about deterioration are not being adequately addressed. It's a formal care pathway for ensuring that the important voices are heard. And it's more than a safety measure. It's a trust-building one. What lessons can we draw from this? First, that safety and quality are not separate objectives, but deeply interwoven initiatives like Martha's Rule highlight, where systems can integrate patient-centered principles to prevent adverse outcomes while also enhancing overall trust. Second, they remind us that leadership plays a vital role in creating these pathways. By supporting and implementing such initiatives, leaders signal that the dignity and voice of every patient truly matter, without any exceptions. So maybe the House of Trust that my friend Peter Lackman and I designed is correct. The supporting pillars of leadership, communication, transparency, and resilience are focus points for the management of the organization. Otherwise, the core values in the middle of the House of Trust will never evolve to person-centered care, where we really take the individual values and norms into account. Let us now go one step further. So, is there a manuscript that really inspired me in my thinking on person-centered care? Yes, there is. The white paper published in 2011 on achieving an exceptional patient and family experience, authored by the Institute for Healthcare Improvement under the lead of Balik and Jim Conway, is for me a cornerstone in redefining how we understand and implement exceptional care. At its heart, the paper provides a framework composed of 5 key levels: evidence-based care, reliability, respectful partnership, hearts and minds, and leadership. Together, these levels create an interconnected system that places patients and families at the forefront of healthcare delivery. So, let's begin with evidence-based care. This level emphasizes that if you want to create an exceptional patient and family experience, the necessity of care is grounded in the best available research and expertise. But it requires healthcare providers to move beyond standardized checklists, embracing a collaborative dialogue that aligns evidence with individual needs and preferences. Next is reliability, a concept that often goes unnoticed until it falters. Reliable care ensures that systems operate seamlessly, delivering consistent results regardless of time or personnel. I always call it 24/7 care. Then there is respectful partnership. That is the third level and arguably the most emotive. It entails fostering relationships built on mutual respect and genuine collaboration. Patients and families are not passive observers, but integral members of the care team. Here lies the power of truly shared decision-making, where the patient's voice carries as much weight as clinical expertise. Respect isn't a checkbox, it is a constant and very active pursuit that resounds across every interaction. The fourth level, hearts and minds, focuses on the emotional bond between healthcare providers and those they serve. Healthcare cannot become an automated process. It must retain its soul, its connection to the humanity it serves. In the paper, they describe it as the hearts and minds of staff and providers are fully engaged. So also when you only have 8 minutes of time for your slot at the outpatient clinic. That is something to think about. Now, finally, as fifth level, leadership ties these components together. It is through visionary and consistent leadership that these values are embedded into healthcare culture. Effective leaders model these principles daily, demonstrating a visible commitment to person-centered care. To illustrate, let me share an example. At one organization I am involved in, together with the CEO, let's call him Mark, me and my colleagues Barbara, and later Laura, initiated lunch with the CEO as storytelling sessions, where the staff shared own patient experiences. There, Mark, as CEO, had to listen for 1 hour to patient stories, and only afterwards, after 1 hour of listening, he could react. Such practices reinforce the deep cultural shift necessary to make patient and family-centered care not just a policy, but a lived reality. Leadership isn't occasional or symbolic. It's enacted in every decision every day. So we have to inspire and educate everyone from bedroom to boardroom. That is what I learned from reading this white paper by IHI. So this will not be easy to bring into practice. So if hearts and minds should be fully engaged and leadership and partnership play each their role. What does it mean to lead with kindness? In 2014, Maureen Bisognano framed this question beautifully through her paper on transformative care models, emphasizing the shift from what's the matter with you to what matters to you. This seemingly simple reframing turns the lens of healthcare toward the individual behind the diagnosis. It positions their values, fears, and aspirations as central to the care process. And while the question may feel philosophical in nature, Maureen's work underscores how deeply it is tied to actionable change. If healthcare providers actively ask and act upon what matters, The resulting trust and alignment lead to significantly better outcomes. If you want to find out more about it, search What Matters to You online or ask my doctoral student Mathieu, who is highly involved in the international think tank on kindness. Okay, now one of the challenges I have as a professor is how can you discuss these matters with students without the risk that the discussion does become weak, trite, or overly emotional? Well, last year I tried something new. In the first year quality course at Leuven University, I asked 614 medical students, so they are on average 18 to 19 years old, to step away from textbooks and protocols and to step into the stories of people. I have to be careful with what I do and say in this class because my daughter Manon, her friends are in that class. And I can tell you that there is live feedback. Okay, back to the mission of these 614 high potentials. The task was simple, yet deeply profound. During their internship, each student sat down with at least one patient and one family member. They asked a deceptively powerful question. Tell me about the human behind the patient. What followed was a wave of reflection, emotion, and insight. The patients opened up about their lives, not just their illnesses. They spoke about love and loss, hope and fear, resilience and vulnerability. They shared memories, dreams, and regrets. And through those stories, they reminded our students and all of us that healthcare is never just about diagnoses or treatments. It's about people. I also told the students, and remember, these are young adults, really at the start of their career, just ask these patients or their family members for advice on what you, as a future healthcare provider, should never ever forget. In other words, ask them for a tip of the day for the rest of your career. One patient said, always stay true to yourself and never stop listening. Another patient urged, don't just treat the disease, see me. So, listening was the number one advice, and the other two concepts in the top three were empathy and kindness. Family members echoed that message, but asked one specific thing: involve us, they said, keep us informed. We know our loved one, we are part of their care, and we want to be part of their care. From all these 614 conversations, some powerful lessons emerged, lessons that can shape a new generation of caregivers. Here are some of the takeaway messages. Empathy builds trust. Listening is healing. Dignity matters. Cultural differences count. Time is short, but presence is powerful. Students realize that good care means seeing the whole person, their body, mind, and soul. It means collaborating across teams, communicating clearly, being both professional and human, and above all, never forgetting the weight and wonder of being allowed in someone's life when they are at their most vulnerable. These were not just learning moments, they were transformation moments. In the second year of medical school, I come back to these lessons and make the link with clinical and psychological safety, and we discuss the role of interprofessional teams. For those who know me, you can imagine that I leave that type of class with lots of positive energy. Thanks to the previous and current Dean, Paul and Chris, for believing in this course on quality and in me. So today, let this be a reminder to all of us, in medicine, in care, and in life. Behind every chart is a story. Behind every symptom is a person. And behind every patient is a human being who longs to be seen, heard, and understood. That is what multidimensional quality truly means, period. I can imagine that you need to reflect on this, or maybe even organize a meeting with your team to discuss why we sometimes forget that this is why we have chosen to work in healthcare. Yes, sometimes we forget how important our role is as caregiver in someone else's life. Okay, I have to discuss the following, of course, in my podcast on person-centered. So, let us now explore a term that has been gaining increasing attention in healthcare settings: mango moments. These are those unexpected, often small gestures of kindness and leadership that can profoundly impact both patients and caregivers. They are named not after the fruit, but rather as a metaphor for something sweet, refreshing, and nourishing in even the most challenging circumstances. Research by myself, Eva, Deborah, Ellen, Charlie, Ellie, and Barbara has demonstrated that these moments don't just brighten someone's day. They can be transformative, creating positive ripples in both personal and organizational relationships. We published a book about mango moments available in Dutch and in English. Let me explain a reflection from Victor Montori on the book. He describes caring as a superpower that resonates deeply with our shared humanity. He observes that care cannot just be an accident, it must be intentional, evident even in the smallest of deeds. Montori speaks of mango moments as flags of resistance against dehumanizing aspects of industrial healthcare. These acts, while seemingly minor, reinforce the idea that healthcare is fundamentally about connection and about restoring humanity in interactions, no matter how procedural they might seem. And my mentor, Peter Lachman, argues that healing is incomplete without kindness, empathy, and the human touch. Lachman's own stories reveal how mango moments are not ancillary to care, but are in fact foundational. A simple act of kindness, for instance, addressing a patient by their name or asking about what truly matters to them, that really reconnects the patient with their humanity, while also reducing the burnout clinicians frequently experience. Lachman reminds us how mutual respect and kindness create a feedback loop of psychological safety for everyone involved, patients and providers alike. So Peter, years ago, already made the link between kindness, burnout, psycho-safety, and many other constructs we now describe in our house of trust. Finally, I want to reflect on the mango moment concept by coming back to what Herman Dames reminds us about. Professor Herman Dames is a captain of industry, a former Leuven and Harvard professor in strategy development. Herman tells us that such moments do not flourish in a vacuum. They require the right climate. Dames draws a valuable parallel, likening mango moments to mangoes that can only grow where the conditions are right. He argues that organizations with cultures shaped by human-centric leadership often see these moments occur naturally. Leadership, Herman asserts, plays a vital role in embedding this ethos into the fabric of healthcare. If leaders model kindness and consistently reinforce its importance, staff will in turn pass that ethos onto their patients. Professor Dames is unequivocal in his belief. Kindness, when nurtured at the top, grows exponentially throughout teams and organizations. Again, something to really think about if you are a manager or director. These reflections highlight that mango moments are truly about person-centered care. For listeners eager to explore mango moments further, I encourage you to visit mangomoment.org, where you can access a 45-minute documentary. Additionally, for those interested in reading more, the Mango Moment book is available on bol.com and Amazon. Okay? As we wrap up this 5th episode of my podcast on quality, I want to turn our focus back to the essence of person-centered care from the perspective of patients and their kin. I hope these conversations have offered you moments of critical reflection on what we do and perhaps, even more importantly, on why we do it. every day, and this across every healthcare organization. So, to conclude, let me share two parting thoughts. The first comes from a deeply personal experience during my own patient journey some years ago when I was admitted with severe acute pancreatitis. You can read my story in the BMJ Leader. I remember lying in my hospital bed with a curtain drawn around me. That curtain, a thin fabric divide, gave a sense of privacy, as if it could block not only vision but also the sound. It didn't. I could hear everything. The whispered critiques of one colleague to another, the frustration with leadership, and even their comments about me, the patient on the other side of the curtain. This thin barrier of fabric revealed more than they realized. For me, it was a moment of deep intrigue, a glimpse into the environment behind the care facade. Dignity and respect was not always there at the other side of the curtain. When it opened, it was, but closed. Well, I invite you to think about what your patients hear, about the worlds you create for them, even unintentionally, through your words and actions also when the curtain is closed. So think about it, discuss it with your colleagues and students. And speaking of worlds, let me revisit a quote I opened this episode with, the words of Don Berwick. Patient-centered care is not the route to the point, it is the point. This sentiment remains as striking to me today as it was when I first heard Don say it during a forum more than 15 years ago. He spoke not just of technical reliability, but of the dignity that every patient deserves. He said, and I quote, "I fear to be a patient. That fear comes partially from what I know about technical hazards and the lack of reliability. But why I really fear to be a patient comes from indignity because of the anonymous thing I am. It scares me to be made helpless before my time, to be made ignorant when I want to know, to be made sit when I want to stand, or to be alone when I want to hold my wife's hand, to eat when I do not wish to eat, to be named what I do not wish to be named, or to be told when I want to be asked, or to be awoken when I want to sleep. Is it this what we call person-centered care? ? This quote by Don Berwick, who I know is one of the people following my podcasts, and that was really my mango moment a few weeks ago when he reacted on this series. Well, his quote of more than 15 years ago, I use every year as final sentences in my class on quality at Leuven University. And hereby, I want to leave you for today. Think about the topics we discussed on person-centered care. Take care of your patients, their kin. Take care of your kin, and please take care of yourself. And do not forget what my great mentor and friend Peter once told me. Always just be a little bit kinder than necessary. So, as I leave you for now, I encourage you to reflect deeply on what we've covered. Let these discussions serve as a guide in your daily interactions with your patients, with their families, and equally important, with yourselves. Kindness is not a luxury in healthcare, it is a necessity. It's what fosters trust, creates connections, and ultimately elevates care from competent to extraordinary. So may I thank you for joining me on this journey. I would love to hear what you think about this podcast and the previous ones. Of course, if you have suggestions for future episodes or themes you'd like me to explore, don't hesitate to contact me. Goodbye for now. Let us all create mango moments, because as we published in our Lancet paper in 2018, mango moments can make healthcare a little sweeter.